Okay, Bert, with your permission, I'm going to ask some questions to see if we can get to the bottom of why you might be at risk of malnutrition. By asking a few of these questions, what we're going to try and do is work out how we can reduce your risk of malnutrition so that you can stay well and healthy and as independent as possible. Does that sound okay with you?
Sounds good to me, Anne-Marie.
Okay. So the first question I have to ask, do you have any trouble with grocery shopping?
Well, it's getting more difficult walking around the supermarket.
Mm-hmm.
And then getting the groceries from the car to the kitchen is quite a bit of a task too.
And what about cooking and feeding yourself?
Well, my wife does most of the cooking, but I have no trouble feeding myself.
Mm-hmm. Okay, so what about any illnesses or health conditions that might affect the kinds of food that you're eating or the amount of food that you might be eating?
Well, I've quite a few ailments. The doctor said to cut down on my salt because of my blood pressure. I get gout, so I have to be careful of shellfish. I haven't felt like eating meat at all since I had that awful flu a few months back.
So when eating, do you eat alone?
I normally eat with my wife.
Mm-hmm.
When she has her ladies' lunches on Wednesday,
Mm-hmm.
I have my main meal alone.
Right.
I normally prepare a sandwich or something easy like that,
Mm-hmm.
and that gives her the day off.
So you said earlier, Bert, that you're eating a lot less than you used to and that you don't always finish your main meal. How often would you be eating food such as eggs, meat and fish?
Well, we eat out on Saturday. That's normally a sandwich or something. Then I eat my main meal by myself on Wednesdays. So it's five meals a week where we eat meat or something like that.
Mm-hmm. And do you eat all of the meat?
No, I try and eat as much as I can. No, that's not true. I try and eat half.
But look, thank you for answering those questions, and I can see that you might be having a few challenges. So what we can do now is have a bit of a chat and see how we can help with some of these challenges.